Hi, Nicole Kelly, nurse practitioner. I'm here at Lébo Skincare Center, and today I'd like to talk about sclerotherapy. Sclerotherapy is a treatment to treat small spider veins. It's called sclerotherapy because we use a sclerosing agent. Actually, 25 million Americans have superficial venous disease, and that venous disease can include varicose veins, tiny little telangiectasias, or little veins that are a little bit bigger than spider veins called venulectasias. I do want to clarify that sclerotherapy here is for treatment of spider veins in the legs. What to expect when you come in? We always do what we call a bedside or a clinical exam where I'll look at your legs circumferentially. If there's any concern that during my exam I feel that you have, or I see varicosities, or I am concerned that you have what's called venous reflux or venous insufficiency, at that point we appropriately refer you to a vascular specialist. If after the exam you seem like a good candidate, then we keep you and we'll begin the sclerotherapy. Here at Lébo we use an agent called polydocanol. It's a sudsing agent. I already have it drawn up and diluted to the percent that that's appropriate for a patient here. And it's called a sudsing agent because if I go back and forth, it gets bubbly and sudsy. We use a very small needle. I'm going to clean the skin off with alcohol. Sorry, this is cold. Behind the knees is a little bit more sensitive than as if I was on the thigh or maybe somewhere in the mid-calf. Alrighty. I'm just going to say 1, 2, 3. And I'm going to go in the vein. And then if you can see how it's starting to fade ever so slightly. I'll push nice and slow. And the reason it looks white is because if you saw a vein without any blood in it, it's actually kind of like this pale white color, and it just takes on the color of whatever you put in it. If I injected purple, it would look purple. Or probably if I injected orange, it would look orange. And we just go nice and slow. And it starts to get pink. And there we go, a little pressure. And this is really how easy it is to do this treatment. How long does a treatment take? It depends how many veins a patient is interested in treatment. Some patients have generalized telangiectasias, or these spider veins all over the legs, and other patients will come in and they'll only just have a patch. So it really depends on, how many vessels are there really to treat. I usually schedule patients out for about 30 to 45 minutes. All patients must bring compression hose with them. And we can talk about compression hose on your initial consultation. And the reason I want you to have compression hose is compression hose help support the vein and compress the vein and help the blood flow go back up to your heart. The compression hose aren't going to get rid of any spider veins, but it actually helps in the development of new spider veins. I see a green reticular vein that I'm thinking about going for. 1, 2, 3. Here we go. And that was my flash. Push nice and slow. So after the treatment, I'm gonna, I ask all patients to wear their compression hose, which we will provide a prescription for you. It's 20 to 30 millimeters of mercury. I ask you to wear them for 2 weeks. You can take them off when you go to sleep. And you can take them off, obviously, when you shower. But outside of that, when your feet land on the floor in the morning, I do ask that you put them on. I'm going to try one more with this syringe. I'm going to shoot for down here. I'm going to aim this way. 1, 2, 3. Let's see how we do here. Oh, perfect. Hope you can see that. Yep. And I'm just kind of watching the solution. Now, some of it's leaking backwards, but it's definitely still going through all these little veins. I look at these cluster of veins like a tree. If I can hit the trunk of the tree and the solution follows all the branches. It's a great win-win. And it really takes a very minute amount of solution, you know, to fill these veins and treat. What are some, while I hold a little pressure, some other thoughts after treatment? You're going to bring your hose, you're going to wear your hose. You can shower. I ask that you don't go in a sauna or have a hot tub or hot tub bath, because it dilates the veins. I want these veins to stay collapsed and compressed. You may walk. No heavy exercise, no heavy lifting for a few days. But again, if you're an exercise, you know, fanatic, you can walk as much as you want. I'm going to bring you back in about 2 weeks for a follow-up visit. See what you look like. Speaking of what you look like, as we go up here, just immediately afterwards, she may have a little bruise here, but you can see that it's starting to get red and inflamed, and that's very normal. After treatment, sometimes it looks like you got bit by like a lot of mosquitoes, and you have redness and inflammation. That lasts for about 48 hours, and then honestly, that goes away. Your veins will look worse before they get better, and when I say worse, they will look darker, and like a dark purple before they begin to fade. And when you see that, I know that when you come back, the vein has been treated successfully, and it's dark purple because there's trapped blood inside that vein, and your body will resorb that, and that will go away with time. We're going to try to get some of these vessels in our patient's foot. The skin down here is a little tougher. And here we go, 1, 2, 3. Sorry. And there we go. I don't know if you're able to see that. There we go. And we'll try another little spot, a little pressure. And you can even see kind of as I massage the solution, as it fills those veins, it takes on the clear color of the sclerotherapy. It's really pretty neat. The sclerotherapy, actually how it works is the medication irritates the inside of the lining of the vein. And eventually it gets so irritated or, you know, kind of swollen that it obstructs the blood flow. And that's really how it works to treat the vein. You know, having less of these disease vessels may help with pain, heaviness, aching. 1, 2, 3. And there we go. You can see it kind of going retrograde a little bit, or backwards. And you can see the veins where I treated before are now getting a little irritated and red, and that's exactly what they're supposed to look like. There we go. A little pressure. 1, 2, 3. And there we go. And you can see that disappear. I hope my head's not in the way. Now, again, it initially disappears, but once I stop putting the clear solution in, it will get red and inflamed. You'll see the vessel again, but then it'll turn darker, and then 3-6 months from now, it'll disappear. It's very well tolerated. It doesn't burn. Does it burn?
Not at all. It doesn't hurt at all.
Great. You don't need to be numbed beforehand. If you're needle phobic, we'll talk to you, we'll play music, we'll hold your hand. I've never had a patient say, that's it, I can't do it. It's all very well tolerated. 1, 2, 3. And there we go. Ooh, that was a good one. And I'm just pushing slowly. Some other things that may happen. You see this little white area here. The nice thing about this medication that we use, called polydocanol, is if any of the solution gets outside the vein, it causes a little bit of redness, but it doesn't cause, it's very kind to the tissue and doesn't cause any problems such as ulcerations. Certainly, if you have any questions that I'm not answering, call Lébo, the Hanover or the York office, to ask questions, schedule an appointment. Consultations are free. Love to see you, and I promise I will steer you in the right direction.